Right, well, my name's Professor Roger Aldridge. I've been involved in MRI research for 36 years. Obviously, that involved making the first scanner, which was made at Nottingham University. And, well, I tell you anything you'd like to know about MRI. Well, MRI stands for magnetic resonance imaging, and so there's two real parts. There's a magnet, and when hydrogen in the form of water is in a magnet, it gets magnetized. In fact, it's the nucleus that gets magnetized, and that aligns in the direction of the magnetic field when you lie inside an MRI system. The resonance part of the magnetic resonance imaging is in order to generate a signal. And to get a signal, you have to drag these nuclei away from magnetic alignment inside the magnet and then release them. And once they're released, they oscillate and give out the MRI signal. So that's the source of the signal. In order to get spatial information, we impose a magnetic field gradient on the subject, and that spreads the signal out in frequency so that we can assign a position to each proton signal within the body, and looking at the mass of protons there, we then generate an image by using these gradients. There's a very slight amount of radiation. It's not electromagnetic radiation. It's mainly a magnetic effect. So you have magnetism in the form of the magnet. You apply an oscillating magnetic field, and that generates an oscillating magnetic signal. It's not, although it's in the radio frequency band, it cannot be really classified as an electromagnetic wave. It's a magnetic phenomenon, and therefore is a very weak force in nature. Magnetism is very weak, and therefore doesn't interact with the body very strongly at all. So we believe it has minimal side effects and is a very safe technique. Yes, there are different types of magnets. The open magnets are preferred by people that suffer from claustrophobia, but they don't generate anywhere near the quality of data that the standard solenoid magnets are. Solenoid magnets look a little bit like an elongated donut. You go through the middle, it's maybe 1.5 meters, 2 meters long, and they're designed very carefully to be uniform in magnetic field to an accuracy of 1 part in a million. And so they're designed very carefully. They're made of superconducting wire, which means that they're kept cold and they have zero resistance. And you introduce a current into the wire, you join the ends of the solenoid inside together, and the current circulates indefinitely as long as the wire is kept cold. So it's kept cold. The only liquid that's cold enough to keep the superconductor at minus 270 degrees centigrade is liquid helium. And liquid helium is a product of radioactive decay, and has basically all the helium we've got has been built up over millions and millions of years in the Earth's crust by alpha particle emission, and those alpha particles then acquire 2 electrons and become helium atoms. Once helium gets in the atmosphere, it's so light that it just floats off into outer space, a bit like air would on the moon. The gravity is not strong enough to keep it. So we have limited supplies of helium, although it's the second most abundant nucleus in the universe. So that's a bit strange, but there's not much of it here on Earth. So that's how magnets are made. I think that's because it's a very insensitive technique. You're asking the person that has pioneered speeding up the acquisition, and I developed, along with my supervisor who won the Nobel Prize, the echoplanar imaging technique, and that can acquire an image in 20 milliseconds, but it can't be much faster than that. Standard techniques take several minutes and produce better resolution, but you can certainly acquire images in 20 milliseconds at a resolution which is sufficient to study functional MRI, diffusion and perfusion. The noise is, it is noisy. You really don't want to go in without earphones. I think the noise is generated by the gradient coils. So we talked earlier about spatial information, and they are produced by turning on gradients, magnetic field gradients. Those coils that generate those gradients act rather like loudspeakers. When you put a current through them, they're in a magnetic field and you get a strong force which knocks the tube. So the knocking sound is the gradients turning on and off. There have been many attempts to make it as quiet as possible, but as long as we still require these gradients to be turned on and off, you're still going to get loud sounds inside MRI machines. Side effects to MRI scans, there are a few. They increase as you go up in magnetic field strength. So we're getting a 70 magnet. A lot of people report a feeling of dizziness as they approach the magnet, or lack of balance. But at the lower field strength of 1.5 and 3T, the effects are very minimal. I don't think anybody's proved that MRI has caused any damage. If you think in terms, it's a magnetic field, and magnetic field involves forces. If you think in terms of a fridge magnet sticks to the fridge indefinitely. So it's not actually taking up any energy to stick to the fridge, and therefore magnetic fields don't necessarily involve exchanging energy with the body or with the fridge. They don't run out of magnetism, and that's a proof that they're not exchanging energy with anything or harming it. I'm not an expert in that, but I would guess it's to do with the balance mechanisms in the ear, which involves fluids. Those fluids are charged, and in a magnetic field, their motion is disturbed because they're charged particles, charged molecules in a magnetic field, and therefore just the disturbance of flow in those organs causes a feeling of dizziness. I think the MRI scans in general are very important because they are sensitive to the state of water in the brain. Unlike X-rays, they give much better contrast. So in multiple sclerosis, there are plaques caused by the disease that you can see. Equally worrying, there are plaques that we can't see, and they're called normal appearing white matter and normal appearing grey matter plaques. They're embedded in that white and grey matter, and therefore we can't see them. And our challenge as MRI scientists are to come up with new contrast mechanisms that might enable us to see the real load of plaques in a disease like multiple sclerosis. So we're really, it's at a stage of trying to improve the range of methods that we can employ in MR in order to study diffusion, perfusion, blood flow. We've seen magnetisation transfer applied. Any mechanism we can get to distinguish between the plaques, the MS plaques, and normal tissue. That's the focus of our research.